Good morning. I'm Councilmember Vincent C. Gray. All right, we'll start on my left and your right. Ms. Ross, for your testimony. Thank all of you for your testimony and your work. We've enjoyed working with you on this bill, and it was absolutely delightful when, at its introduction last week, we had 13 of us who were co-introducing the bill, and you'll have other opportunities as well to be able to speak to that when we have the hearing on it. And if you permit me to single out Alma Gates, who really has done an extraordinary job on this issue. She's a frequent testifier. She's a great advocate. Let me just put it that way. And you all ought to be very thankful for having someone like her who's got the level of respect that she has down here. And again, we had promised her on your behalf that we would move forward with getting this bill done. And we were happy to be able to get it to the point of being able to be introduced. Now, of course, that's the beginning of the legislative process. So I'm going to ask you all to continue to do what you've done up to now, and that is make sure that my colleagues on the Health Committee are cognizant of that, since the bill is in our committee now, and then, of course, along the way, the other members of the council. I'm sure that Councilmember Nadeau, who I'm going to turn to shortly, has heard you loudly and clearly today. And she is one of the co-introducers also, and I want to thank her for having joined with us to be able to move the bill forward. Ms. Ross, you talked about being able to generate additional resources. You also made the statement, I think, that a decision as to how some of these incidents are being handled was made at above someone's head, I think it was. When you talk about additional resources, what is it that you're referring to?
Based on my personal interactions with the Office of the Ombudsman and DOH, there clearly is a need for more personnel to do the work. That the workload is too great for the staff that is currently in place. So DOH is only able to do one inspection per year, for example, at assisted living facilities, and to respond to specific complaints. Likewise, I think you heard Mark Miller, the Ombudsman, speak about the workload he has in terms of the inspections he needs to make, not only on assisted living facilities, but things like community residence facilities that are numerous and more difficult to regulate. So my recommendation to the committee would be to look for some additional funding for both DOH and the Ombudsman.
We have, I've talked directly to the Ombudsman about, his need for additional resources, and last time he and I, spoke about this, he was not able to articulate then what additional resources, would be necessary. If you all have some thoughts with specificity on what that would look like, I would appreciate receiving that as well, and we hope that you're speaking to him as well about the additional resources that you believe would be necessary to make this a more effective endeavor. Can you articulate again, you said a decision. What was that decision that was being made above the head of, of the person that you were talking to?
Someone in the Department of Health authorized Grand Oaks managers to accompany the DOH surveyors to the doors of residents who had offered to speak to DOH surveyors about problems and had information they wanted to offer DOH. That is typically the sort of thing that residents are not willing to have management know they are doing. And when they ask to speak to a DOH inspector or surveyor. They typically would like privacy, and they would prefer that management not know they're talking to them because there is a fear of retaliation. And good,
Actually perfectly understandable that folks would feel that way.
yeah, yes, and I've been retaliated against, and am being retaliated against on an ongoing basis. So residents' fears are not unfounded, and residents should feel free to speak to a DOH surveyor without management being aware of it. And somebody at DOH made the decision that the surveyors would have to allow Grand Oaks managers to accompany them. And this has happened, has been the case for at least the last 2 years.
Do you know who made that decision?
No, but I'd be interested in knowing.
So would we. But you know, you obviously know who was that imparted that information to you, is that correct?
It was the surveyors themselves. So the HRLA surveyor team that came to do the annual licensure survey told me that they had been instructed that Grand Oaks managers were to be allowed to accompany them to the doors of residents who had asked to speak.
They were instructed to do that by someone within DOH?
By somebody above them, above their level, but they didn't say who.
Do you have the names of those surveyors so we can follow up with
Yes, I
Director
do.
Nesbitt?
Yes, I do.
Okay, I'd like to have those.
okay.
things. Okay, I'd appreciate that. Ms. Kinkle, you have a heart-rending story, what happened to your mother, and I appreciate you having the wherewithal to come down today and even testify. And I hope you will have the wherewithal to work with us as we try to get this bill approved. I suspect that your story is not the only one, that there are others in assisted living situations that have been subjected to this as well. We've seen, increasingly large numbers of people who are older, whose families do the best they can, to try to take care of them and find them in untoward experiences like you described today. And I suspect that Ms. Ross and Ms. Hare and Ms. Gates all have similar stories that they can recount. They've shared, Alma in particular, has shared some of those incidents that she knows about with us as well. And we hope that the bill will be able to move us forward. We recognize also that in and of itself, legislation is not a panacea. It's effective enforcement, its implementation as intended, and the internalizing, if you will, of the principles, and values underlying the legislation is really the most important thing. So, I don't want us to be too effusive about, where we are at this stage. We've made a step, but we've got a long journey ahead of us. Hopefully to get this moved quickly through the process, the legislative process here, and hopefully signed quickly then by the mayor. But then the resources that will be necessary will need your help to help make that case. And then a continuing effort on your respective parts to be able to make sure that we get people properly trained, get the right people hired in the first place into these jobs. It is not lost on me, the experiences that you all have had. It's not new, what I've heard here today and then in other situations about some of the callous ways in which people are, treated by those who work with them, and they're in such vulnerable situations. Aging has its, has its challenges, to say the least. And, because someone is moving slowly, it should not be a reason for them not to be treated properly. That is a value, if you will, of aging. And that is that people would like to move more quickly. Of course they would. But it just doesn't happen with some people. So I thank you all very much for your advocacy. I thank you for coming down to testify today. I'll certainly want to hear more from DOH about the information that was provided to you, Ms. Ross, about the surveyors and why, if that's a policy, why is that a policy? That makes people quite vulnerable in lots of ways, it seems to me. So thank you all very much. Let me turn to Councilmember Nadeau now.
Thank you, Mr. Chairman. I had all these questions for this panel, and they just did such a good job that they answered them all in their testimony, so I won't make them repeat themselves. But I will say that I want to thank each of you for sharing personal stories, for getting involved in this issue as an elected official, and for working so hard to get this omnibus bill forward so that we can correct some of these challenges. It's never okay for the things that you've shared to be happening, not to anyone, let alone to vulnerable seniors. I just came downstairs from our hearing on the Office on Aging. There's obviously a lot of synergy between these two hearings today. And so I just want you to know that I'm with you, and we'll do everything we can to get the omnibus bill through quickly. Thank you so much. Thank you, Mr. Chairman.
Thank you much, Council Member. Thank you very much, Councilmember Nadeau. And I, again, not to be redundant, but I'm not sure I could be too redundant on this issue. And I want to thank you all for being in the lives of your family and friends, and doing this as well on behalf of so many other people who depend mightily upon you for the kind of advocacy and the kind of support and the kind of engagement that you have demonstrated. And again, I hope you all will come back, and I know you will. I don't think you need to when we schedule a hearing on these bills. And it wasn't just, we had two bills that had 100% support on an introductory basis from the council. So I'll look forward to seeing you then, and I hope you will say the same things then that you said today. So thank you all very much for your testimony.
Mr. Chairman, if I might, thank you very much for the credit. It certainly doesn't belong to me. This has been a great panel, and we are really ready to go on this bill. So expect to see us.
Alma, I'd be disappointed if I didn't. Thank you all very much.